Latent Mycobacterium tuberculosis infection. Introduction. The natural story of tuberculosis begins with the inhalation of Mycobacterium tuberculosis organisms. A period of bacterial replication and dissemination ensued, followed by immunologic containment of viable bacilli. The video.
An estimated 1/3 of the world's population is infected with tuberculosis. 1/3. And here's the culprit, the minuscule bacterium called Mycobacterium tuberculosis. But does that mean 2.3 billion people are sick? Fortunately not. Only a small proportion of them actually become sick. To understand why, let's take a closer look at the bacterium itself. When someone with TB coughs, they expel little drops of saliva that fly into the air. Some of them may contain the TB mycobacteria, which can then be inhaled by someone close by. Mycobacteria then continue their journey down the respiratory tract and into the lungs. That person is then infected with TB. And this is where it all becomes a little more complicated. The body detects the invasion and sends out its first line of defense. This includes special cells called macrophages, which engulf the mycobacteria and transport them to the lymph nodes, where they are neutralized. If they're neutralized, the person will have what is called latent tuberculosis. This means they're infected with the bacterium, but they don't have active TB disease, and they're not sick. However, in 5% of cases, the immune system is overwhelmed. The TB mycobacteria multiply and escape, and the person falls ill. This often happens with young children, whose immune systems are not fully developed. In other cases, latent TB can wake up and become active TB. This can happen months later, or even years later, especially in adults with weak immune systems. For example, people who are HIV positive, or who've had organ transplants, or who are undergoing chemotherapy. Once in the lungs, the bacteria may spread via the bloodstream or the lymphatic system to other parts of the body, to the lymph nodes, bones and joints, the digestive system, the central nervous system, the liver, or the heart. So what happens when someone has active TB? Let's imagine the infections in the lungs, as this is the most commonplace. The patient starts coughing, has difficulty breathing, and suffers from chest pains. If these symptoms last for more than a few weeks, and are accompanied by fever, night sweats, and weight loss, the doctor has good reason to suspect tuberculosis. The next stage is diagnosis, and then treatment. The battle is far from over.
Pathogenesis. After inhalation of tuberculosis, innate immune responses in viable alveolar macrophages and granulocytes begin to combat the infection. In some persons, the bacilli are clearing, whereas in others, infection is stabilizing. The video.
Infection is by inhaling droplets that need only contain 3 bacteria. This is an incredibly small infectious dose. Most infectious diseases require more than 1,000 bacteria for successful infection. Sneezing is the most effective transmission mode, as bacteria remain airborne in small droplets for hours. Mycobacteria advertise to patrolling macrophages by producing proteins that interact with many host cell receptors. The arrest of phagosome maturation is a clear pathogenic determinant in tuberculosis. Mycobacteria prevent phagosome maturation using LAM, a mycobacterial cell wall lipoglycan, by a process that has not been fully elucidated. Acidification fails to occur and bacterial death is avoided. Phagocytosed mycobacteria induce a localized inflammatory response that leads to recruitment of mononuclear cells from neighboring blood vessels. T-cell-activated macrophages attack infection sites, which results in the pathology of tuberculosis. Tubercles, cheesy white lesions, or caseation necrosis, are the hallmark of this debilitating disease. Mycobacterium tuberculosis can persist inside these lesions because they are hidden from the cellular immune response.
Diagnosis. There are the perfect model for the diagnosis of latent tuberculosis infection. The test is indirectly measure tuberculosis infection by detecting memory T-cell response, which reveals only the presence of host sensation to tuberculosis antigens. Treatment. The aim of the treatment of latent tuberculosis infection is the prevention of progression to active clinical disease. Recent studies of interaction between repenting white or warts, incisive and operative showing that co-administration of every for the treatment of HIV infection did not result in reduced oncogenic parts activator activity. Conclusion. Identification and treatment of latent infection individual has greatly helped in control of TB and reach advances countries on similar approaches hold great promise for other countries which low intermediate rate of tuberculosis incidence.